Iron deficiency anemia. Iron deficiency anemia, IDA, is the most common type of anemia worldwide, resulting from a lack of sufficient iron to produce hemoglobin, the protein in red blood cells responsible for oxygen transport. It can affect individuals of all ages but is particularly prevalent in women, children, and those with poor dietary intake or chronic blood loss. Pathology and pathogenesis. The core issue in iron deficiency anemia lies in insufficient iron stores within the body. Iron is necessary for the synthesis of hemoglobin in red blood cells. When the body doesn't have enough iron, the production of hemoglobin decreases, leading to smaller and fewer red blood cells, microcytic hypochromic anemia. The pathogenesis of iron deficiency anemia typically starts with iron depletion. Initially, iron stores are used up, but the production of red blood cells continues at a normal rate. As the iron stores become completely depleted, the body can no longer produce hemoglobin in adequate amounts. This results in decreased red blood cell production in smaller cells that contain less hemoglobin, thus impairing oxygen transport throughout the body. Causes of iron deficiency anemia. The most common causes include inadequate dietary intake, a lack of iron-rich foods like meat, leafy vegetables, and legumes. Chronic blood loss, conditions like heavy menstrual periods, gastrointestinal bleeding, or ulcers. Increased iron demand. Pregnancy, growth spurts in children, and breastfeeding increase iron needs. Malabsorption. Conditions like celiac disease or after gastric surgery reduce iron absorption from the intestine. Signs and symptoms. Iron deficiency anemia manifests with a variety of symptoms, which can range from mild to severe. Common symptoms include fatigue and weakness. Reduced oxygen supply to tissues causes tiredness. Paleness. A decrease in red blood cells leads to a pale complexion. Shortness of breath. Even with mild exertion, the body struggles to transport enough oxygen. Dizziness or headaches. Reduced oxygen delivery to the brain may cause these symptoms. Cold hands and feet. Poor circulation due to insufficient hemoglobin. Brittle nails and hair. Iron deficiency can affect the health of nails and hair, leading to breakage. Pica. An unusual craving for non-food items like dirt or ice, which is a well-known symptom of severe iron deficiency. Complications of iron deficiency anemia. If left untreated, iron deficiency anemia can lead to several complications. Impaired immune function. The immune system becomes weaker, making individuals more susceptible to infections. Heart problems. The heart works harder to deliver oxygen to the tissues, which can lead to heart enlargement or failure. Delayed growth in children. Children with iron deficiency anemia may experience delays in development and growth. Pregnancy complications. Pregnant women with iron deficiency anemia have a higher risk of premature birth, low birth weight, and postpartum depression. Diagnosis. A diagnosis of iron deficiency anemia is confirmed through blood tests. These typically include complete blood count, CBC. This shows low hemoglobin levels, microcytic and hypochromic red blood cells. Serum ferritin. This measures iron stores in the body. Low ferritin levels are indicative of iron deficiency. Serum iron and total iron binding capacity, TIBC. These tests help determine iron levels in the blood and the body's capacity to transport it. Management and treatment. Iron deficiency anemia can be effectively managed with a combination of dietary changes, iron supplementation, and addressing the underlying causes of the condition. Iron supplements. Oral iron supplements like ferrous sulfate are commonly prescribed to restore iron levels. These are typically taken for several months, even after symptoms resolve, to replenish iron stores. Dietary modifications. Increasing the intake of iron-rich foods like lean meats, spinach, legumes, and fortified cereals helps provide the body with the necessary nutrients. Combining iron-rich foods with vitamin C enhances iron absorption. Treating underlying conditions. If the anemia is due to blood loss, e.g., from ulcers, heavy menstruation, treating the underlying cause is crucial. In cases of malabsorption, addressing gastrointestinal conditions is essential. Intravenous iron. For individuals who cannot tolerate oral iron or have severe anemia, intravenous iron may be recommended for faster repletion.